Well, the wait is much longer and the cost is much higher. Still, people crowd hospital emergency rooms to overflowing. Many of them have minor illnesses and could be better served elsewhere. The problem is some have no other access to a doctor. Health reporter Lorie explains.
Most hospital emergency departments must treat anyone, even if they don't have an ability to pay or an actual emergency. Likewise, ambulances almost always transport patients to the ER, regardless of the medical need. Far too many people in underserved communities come here to the emergency department for primary care, things like a cough or a sore throat, simply because they don't have access to a regular doctor and feel they have nowhere else to go. Government studies show about 25% of ER visits to be unnecessary, adding up to more than $4 billion each year. Those visits are also one of the most expensive ways to receive medical care, averaging $2,500. That's a heavy financial burden, and when bills go unpaid, hospitals generally absorb the costs and try to recoup that money from other patients, like charging $8 for a single aspirin.
It is a real problem, and it's getting to be a bigger problem all the time.
Dr. Alan Lindeman is one of the few physicians serving rural North Dakota. He says people living in sparsely populated areas across the country don't usually have access to a primary care physician.
People, unfortunately, use the emergency room for default care because the patients can't get care any other way.
And it also happens in underprivileged urban areas where residents rarely have a nearby doctor's office and no transportation.
We need to take our care and put it in the areas of need.
And some medical providers like Centera Healthcare are doing just that by opening primary care clinics in underserved areas like this one inside a Norfolk, Virginia homeless shelter.
It helps you out a lot. They help you out a whole lot.
These shelter clinics can also help the overall health system. In the 5 months that shelter guests have had convenient access to a doctor, trips to the emergency room for relatively minor issues have dropped a whopping 80%.
And it was interesting, the administrators here said, I'm not hearing the ambulances come as much. I used to hear the ambulances just about every afternoon coming by here, and I'm not hearing that as much.
Fewer unnecessary visits allow hospital staff to focus more on life-threatening issues.
Emergency rooms are very busy. And, they're there to take care of the people that have accidents. If you have chest pain or trouble breathing, that's where you need to go.
While easing that pressure is a positive benefit, Reverend William Crawley points out that's not the main purpose of this Christian homeless shelter.
I believe it's our Christian mandate. We believe it's our Christian resolve to meet people where they are, to love our neighbor as we love ourselves and as we consider ourselves, and we want to be attended to and want to have the fullness of health. Why wouldn't we not want that for our fellow neighbor?
In addition to the doctor's office inside the shelter, Centera has also opened a permanent primary care clinic in a nearby underprivileged neighborhood. The medical provider also regularly drives RVs converted into mobile doctor's offices to other underserved neighborhoods. Although updated data isn't yet available, it's likely these efforts will have a greater impact on reducing the number of people going to the ER for primary care.
Somebody has a sinus infection and they're seen in a doctor's office, a primary care office. The cost of that visit to both the patient as a copay and to the healthcare system is a lot less than if that same patient went to the emergency room for a sinus infection.
It's also likely cheaper in the long run, too, by preventing expensive, catastrophic health problems down the road.
If we're controlling their diabetes, if we're controlling their blood pressure, then they're not going to end up on dialysis from their diabetes. They're not going to end up with a stroke because their blood pressure's out of control.
If this new model can change the long tradition of requiring patients to either find a doctor or go to the emergency room, there's potential for a major positive impact. By putting family physicians closer to the people, better one-on-one treatment can happen, and ERs can go back to quickly providing true emergency care. Lorie Johnson, CBN News.